Once you've decided to have an operation, I need to obtain your informed consent. That means I need your agreement to perform the surgery once you've had a chance to find out what it involves and about the major potential complications. These are the things that can and very occasionally do go wrong with surgery and that might limit your result or prolong your recovery. Let me take you through a few of these. The first one to mention is infection. Prevention is better than cure, so we do your surgery as quickly and efficiently as possible. We do it in a clean air environment and we use preventative antibiotics. If you do happen to get a superficial infection, antibiotics may be enough. But if the infection goes deep or into the joint, you may require visits to surgery for other procedures. The next one to mention is deep venous thrombosis, or DVT. That means forming a small blood clot in your leg, which can float up to your lungs and make you very ill. There are a number of things we do to prevent this occurring, including you getting up and about as quickly as possible and using a blood thinning medication for the first weeks of your recovery. If damage to arteries or veins occurs at the time of the operation, these can usually be repaired at the time. Damage or stretching of the nerve, however, might result in some weakness in the muscle groups of your leg, which will delay your recovery or limit your result. Damage to the bone is also usually recognised and therefore repaired at the time of surgery. If you have a hip replacement, it's possible to actually dislocate your prosthesis, but that's usually avoided by speaking to the physios and following their instructions, and also those of the nursing staff. Leg length discrepancy is something I avoid by using a special measuring technique during your operation. If you have any problems with your general health, I might send you to one of my physician colleagues, such as a cardiologist or a lung physician, so that we can get you as healthy as possible before we start. We want to make your procedure as smooth as possible so that you have a trouble-free recovery.